Hi Oxford Facebook followers, my name is Matt Ernst. We're here today at Freedom Park in Edgewood, Kentucky. I have with me today Brenna, one of our physical therapy helpers from the Chapel Place office. Brenna's an avid runner and a local track coach. And my lovely daughter Sophia, who starts cross-country practice tonight. So what we're going to talk about today are some tips and techniques and just explain a little bit about what Sever's disease is and maybe how you can avoid it or what to recognize if you might have that problem going on.
So 3 common things I think we overlook as runners and athletes are your warm-up and cool-down, getting stretching routine in on that, your recovery and rest days, and having a good pair of shoes. So starting with that warm-up and cool-down, 3 exercises that we like to focus on to really target the quad, hamstring, and calves. Sophia's going to demonstrate for us. So first she's going to show you the toe touches. So you want to come down, keep that toe pointed up, really feel a good stretch, and then you're going to take a couple steps and move on to the next foot. Great, and then the next one is a walking quad stretch. So she's going to take a step, pull her foot behind her heel, really keep that knee in alignment so she's not pulling her foot out to the side. And you always want to pause and then take a couple steps. Great, and the last one she's going to show you is a hamstring swing. So she's going to kick her leg up, reach with the opposite arm to the opposite leg. Good, keeping that toe up and really getting some flexibility in those hamstrings. And then the other 2 components of our running routine you want to focus on are those rest and recovery days. So getting out, biking, jumping in the swimming pool, taking a walk with your dog at night to help get out of the running but still staying active. And then finally having a good pair of shoes is great, and we're lucky in Cincinnati to have multiple outfitters to find a good pair for you.
Thanks a lot, Brenna, for showing those. So what you might first recognize if your child or if you're watching this video and yourself are suffering from Sever's disease is an onset of pain at the heel. If I could borrow Sophia's foot, just turn this way a little bit. So typically right here where the muscles come down and insert into the heel is where people will first start to complain of pain. In younger kids, what we start to see is that they begin to walk on their toe or run on their toe, and they develop an awkward pattern. Kids love to play, as we all know. It's a beautiful day today. They're out running around, and they don't want to stop. So as they're running around, they want to continue, so they develop these compensations. If you start to have pain in the heel, your kids are running awkwardly, best thing to do is visit our website, find one of our over 20 locations in the tri-state, bring them in for a free injury screen. One of our physical therapists can take a look at them and determine if this is what's going on and start a program to help get them feeling better.
All right. There were a few people watching, but if anybody does have any other questions, make sure to visit our website. Thank you, guys.
Thanks a lot.
Thank you.